Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Hello. I almost wanted to say welcome back to the channel, because that's what my kids like to pretend like I should say my son. He's, well, not my daughter. He's always pretending like he's got this YouTube channel, which is funny because he doesn't get to watch YouTube. So hello, we are back. What's interesting about us recording this right now is our last two episodes we recorded a month ago and had a little break from recording. And so it feels like we haven't done this in a while, but episodes have been coming out. So if you haven't listened to our past two episodes with our good friend Paige, we would really urge you to pause, or after this episode, go back and listen to them. They are on pain reprocessing therapy and just chronic pain. And they are some really awesome episodes full of really good information for providers and just the, just regular population of potentially patients. So go back and check those out. We'll start with our usual. Tell us something good. So Roxy, what's been going on?
What has been good? There's been a lot of good things. I think just this last week's been real rainy, and I love the rain. I thrive off of it. A rainy, cloudy day is just, yes, it feels fresh and clean. And so that's been really energizing for me, actually. I know some people are like, give me the sun. And I get it.
Mm-hmm.
I appreciate the sun too. But I have been loving the rainy weather, a little bit slower, dreary weather. But I think we're done. I think the sun's going to be out for a while now, and summer's going to hit us. It's actually here. It hasn't felt like it, but it's here. So I've particularly enjoyed that.
Yes, I too like the rain. However, it was getting kind of old over here. Well, I think the reason why I love the rain, but our backyard is not the best when it comes to rain. And so it was just sad to see it that could be a whole nother conversation. Anyway, let's see. I kind of feel the same way. There's just been lots of good happening amidst, just hard things too. But I would say, I think just for us, even though transitions sometimes can be hard, but just kind of coming into summer, and my daughter started conditioning for basketball, and she's got to get up and, go at 6:30 in the morning, and started last week. And so it's a couple hours, and then she goes into the gym and they work on basketball stuff. So it's a good chunk of her morning. And I'm just really impressed and proud of her I know we're only a week into it, but just seeing her show up and do it anyway, even though it's hard. And I think there's just so many good lessons in that. So, all right. Well, we are going to kick off this first episode that's coming out here in June. It is Men's Health Month for the month of June, amongst other things. I swear every time I turn around, it's a week, whatever week. But we have an episode today. We're going to talk about men's pelvic health, and hopefully it provides some insight. If you're listening to this and you have a family member that you think this would be helpful for, pass it along. Or if you're a male listening to this and you know anybody that's dealt with some of these issues, then hopefully you can be a good friend and help them out. So, all right. So today we're going to tackle a topic that doesn't nearly get enough airtime or talked about, which is men's pelvic health. Whether you're experiencing symptoms or just wanting to understand your body better, this episode is going to be for you. At Kansas Pelvic Health and Wellness and Good Life Pelvic Health, both of our clinics treat a growing number of men that are struggling with things like urinary urgency, pelvic pain, post-surgical recovery, but most of them have waited months or even years before finding help. And I think that is a big trend that we're kind of noticing at our clinic with the feedback from the guys that we have been treating, is afterwards they give like a testimonial. And one of the things they say is, I had been dealing with this for years. Hopefully we can get more awareness and more discussion out there about these topics so that guys get in sooner. Hopefully you learn from this.
Yeah, we're gonna jump right in to just talking about the anatomy, just the of men. And so sometimes even people, it's a shock that they don't even realize that men have pelvic floors, which is like kind of funny, but also it's understandable because I think that while we see that women a lot of times are underserved in this area, and we're pushing to try to educate and acknowledge and make pelvic floor therapy more of like a norm and a common thing, men are definitely more underserved than women are, and so a lot of times people, especially women, are like, "Oh, my husband has a pelvic floor." It's like, yeah, it does. And so it's the same. I mean, it's just like a woman. It's a group of muscles that's at the base of the pelvis, and it supports the bladder, the rectum, and then the reproductive organs. And so one, obviously a huge difference is as females, we have three orifices. Males have two. The prostate's right in between like the bladder and the penis, basically, but the urethra goes through it. And so that's where we see that the like bladder control, bowel control, that all is, part of the pelvic floor's role. Also sexual health, erections, ejaculation. The urethra does it all for a man. They ejaculate out of it and they urinate out of it. And then the pelvic floor is right there, like in between the outside and the inside, basically.
And we wish we had like a video right
Yeah,
now
I
to
wish
show.
I could do that. But if you can imagine if you're a female, if you can imagine where you can imagine your pelvic floor to be, obviously a male has a penis and testicles that come out from that. The pelvic floor is above those, or, in between those and the organs. And so if you can kind of anatomically
Yep.
make that picture in your head, that's good. And just like in females, core postural stability is huge. The pelvic floor, if you go back, I think we talked about the 5 S's maybe of pelvic floor in some episodes somewhere. So you just have to listen to a bunch of them and figure it out. But the male pelvic floor does the exact same, has the same roles. The anatomy is just a smidge different because we have 3 holes, they have 2. And the like reproductive piece is obviously a little bit different. And ejaculation is a little bit different, those things. But for the most part, it looks very, very similar. Just a big misunderstanding and that comes along with that is we're just considering that males actually have a pelvic floor and it actually works. It's supposed to work. And it can be dysfunctional, is that then pelvic floor issues are just for women. And that is very, very false. Because they have a pelvic floor, any piece of anatomy we have is meant to be functional. Therefore, it can be dysfunctional. And so Megan's going to jump in here and introduce, or hopefully these aren't new, but just talk about some of the common dysfunctions that men struggle with when their pelvic floor isn't working well.
So I'm going to talk and share a little bit about common pelvic floor issues in men. But before I go into that, I just want to say we get the question a lot of saying like, okay, so men have pelvic floors as well. So how do you treat a male pelvic floor? Because obviously with female pelvic floor therapy, a lot of people are very aware that we do internal work. And to do that, it's often intravaginally. But just like in females, we also do rectal work because we're able to get to those deeper layers of the pelvic floor a lot easier that way. And there might be a reason why we need to be focusing on treatment through doing intrarectal work. So in males, obviously, we don't have that option to do intravaginally. And so if you need internal work as a male, that's how we do that, is intrarectally. And that sounds, it's like that's where a lot of guys are like, oh, I don't know if I want to do that or not. But there's lots of tools in the toolbox. There's lots of ways to treat externally that are very, very helpful. And again, we always like to give all of our options when we're working with the male population so that we can properly assess and address what the dysfunction is. So if you've been dealing with something for a really long time, most of the time, these guys are like, whatever you need to do, let's just get it done and go for it, get it over with, get through it. And also, they've been to like 5 or 6 doctors typically by the time they come to a pelvic floor therapist, and no one's ever even like touched them. So there's that too. But anyway, let's move on to common pelvic floor issues in men. We're going to break these down into some of the most common diagnoses and complaints. So a lot of these you're going to see are very much overlap. So urinary symptoms, pelvic floor dysfunction in women, also in men. They'll have urgency, frequency, dribbling, post-void leakage. And this is often mistaken for like prostate only issues. So, of course, we're always going to make sure and get the prostate checked with stuff like this. But this also, the prostate can be fine. And these are a sign of overactive pelvic floor, also, combined with probably tissue tightness and nervous system irregulation, stuff like that. So urinary symptoms, very, very common. Pelvic pain. Okay, so testicular pain, tailbone pain, perineal pain, and this is often misdiagnosed as prostatitis. So yes, we're going to clear the prostate. However, testicular pain, that is a very, very common thing that we hear. Roxy, I know you can probably speak into this, especially I know you're close to a military base and have shared before you see quite a few men, pilots. We'll pause and let you kind of explain that a little bit. But testicular pain is really common too after like post vasectomy. And that can be cleared up so easily with a pelvic floor therapist and with not even internal work most of the time. But Roxy, talk a little bit about pelvic pain in men and testicular pain and that sort of thing, because I know you see a lot of this.
Yeah, and I would add in there too, like rectal spasms is a big one too, that usually isn't the start, but maybe
Yeah, oh,
that's what
yeah,
really
yeah.
pushes guys over the edge. And then we get into the nitty-gritty of the history and it's like, oh, there was some other stuff going on. They kind of dismissed it or they just lived with it. And so like that can be a big like trigger. But like, you all know, hopefully Megan and I just really treat holistic, like the whole body. A lot of times what we're seeing with that is like, I think a couple different things here, but there's a lot of times that you get really young, active men that have this testicular pain, and there's big drivers behind it. A big chunk of my male pelvic pain patients are active duty soldiers. And so there can be a lot of trauma, there can be a lot of tension, there's high expectation, there's a lot of nervous system component into that. And then seriously go back and listen to Paige's episode because this is perfect that we're talking even just about pelvic pain after this, because then there gets to be an anticipation. And so their squat mechanics start to change. The way that their posture and their positioning starts to change. Their body gets really tight, even though they're lifting and they're active and they're trying to maintain a certain level of physical activity. Like the mechanics kind of go out the window and it's really kind of trash and it starts to then fuel tension. And thinking about then when the muscles are tight, that usually there's a factor in there where it pinches blood flow, it pinches nerves, it restricts just good mobility there. And so a lot of times it comes down to just like you just looking at this person, you would never think there's loads of dysfunction happening. But when these guys come in, there's big underlying issues. And one of the biggest, there's a huge postural mechanical coordination piece in there that happens where there's just a lot of tension and guarding. But then there's usually a lot of then shame because men don't want to talk about this as females. We're used to having PAPs done and we're used to talking about this. And if we've had babies, we're like used to half the hospital seeing us when that situation, But men oftentimes, this is the first thing that they've ever had to, like, it'd be like if we were going in to have, a well woman check when we're in like middle school, high school, or just even having those conversations. It's like the first time is awkward sometimes. And that's a lot of times then there's a lot of shame or fear or just like, get me out of this situation. And so then even that piece kind of fuels it. That's, I guess, a big thing that I tend to see with that, especially that testicular pain. And that isn't always, sometimes it's what's really hard with it too, is it can just be like it's quick stab here and there randomly while they're out the grocery store or whatever. It can be like during or after ejaculation is another really common one. So that the manifest or the presentation, I guess I should say, looks a lot different depending on the man.
Yeah, and I think with that, I'll just share because I know my husband won't care if I share the story because gosh, I can't remember how many months ago it was. He had a vasectomy last year. And I will say, just a couple of things you mentioned that I found really fascinating was I know that sometimes we like to give men a hard time about this, like, it's like a little snip, get over it. It's no big deal, And I mean, given it compared to labor, yeah. But I will say one of the things he said was he was like, like, I'm sorry, I'm just not like, I haven't like experienced, I'm not comfortable with, like, I'm just laying there just exposed with a whole bunch of people around me. And I recognized right away, like, I didn't say, I was just like, that's fair. Like, it's fair. Like, to your point, Roxy, like, we have gone, we are used to going and getting a PAP every year, and that's just part of it. And we do have to hold space for the fact that, like, that's not something common to have multiple people like looking and you kind of being on display. So I thought that was an interesting, like, that's like right at the Z experience. So you're like anticipating like this pain, you are having a surgery or damage to a tissue. Now you've had this level of like emotional sense of like just embarrassment or whatever it is. And then you're told like you'll be good in 3 days. Well, I always tell people, if you want to know one of my secrets, is it's not really secret. I tell people, if a doctor tells you it's going to be 4 days recovery, double it. Just double it, because it's never the amount. So then they have in their head, I'm going to get through this. This is going to be done in 3 or 4 days. So then when there's still lingering soreness, now we've laid down this questioning of, this isn't healing right. Something's wrong. And that drives this overregulation, maybe more tension. And it was fascinating for me to kind of see this happen in real time with my own husband. And after the 3 to 4 days, he was still given, he doesn't sit down much. So he's on his feet a lot. And then he was a teacher at the time. And so he was on his feet all day long. So goes back to work and he's like, wow, I thought I'd be through this. Well, so then he started to get nervous that something was wrong. I could tell. And I can't remember if like a week had gone by, but we were just like sitting waiting for church service to start. And I could tell he was like not himself because it was in his head now. So it was not right. And I was just like, hey, listen, I 100% know that like we could take care of this. Like if there is something going on, like we have treatment to help with this. And I think it's really, I was just like very like diplomatic about it and educational about it. And half the time, the reason why pain is lingering is because we are anticipating that there's something wrong. And like we had this whole conversation and the next day there was no pain and it was all gone and done. So I think it's really fascinating. Again, listen to Paige's episode. The pain science piece is really intriguing. And you could see where clearly, I mean, this is what Roxy and I do. But if a guy goes and gets this done and then he's in his head about it, how it can overdrive and we get this pain. And so then it goes on for months and months and months. And to Roxy's point, it's like they just don't talk about it, or they try to go talk about it, they get dismissed. And we'll talk about that's kind of like a little bit more what we touch on. But anyway, I don't know. Just thought that was an interesting kind of example of how pelvic pain can develop, or testicular pain. So yeah, other common pelvic floor issues in men: sexual dysfunction, so erectile dysfunction or premature ejaculation, pain with arousal or orgasm, like Roxy mentioned. One other like common diagnosis or complaint is post-surgical recovery, just like I mentioned, after a vasectomy or after prostatectomy or hernia repair. There's scar tissue, nerve involvement, nerve irritation, bladder control issues. And then another common thing that we see is athletic or lifting injuries. So like groin pain, SI joint dysfunction, abdominal wall strain. We see this in lifters, runners, high impact athletes. And obviously that lines up more. I mean, obviously pelvic health is ortho therapy, but that kind of stuff we just think ortho, but sometimes a pelvic health provider can be really a great person to go see just because that is right in the area of our expertise. So those are the top 5 that we see. Of course, there's other ones too, and there's subcategories to all of these. But urinary symptoms, pelvic pain, sexual dysfunction, post-surgical recovery, and athletic and lifting injuries are those 5 common diagnoses or complaints that we see.
And I would maybe just to piggyback off the athletic lifting injuries, I've seen a handful of guys lately that have had these like, oh yeah, in high school I did this. It flares up every once in a while. So like they either didn't get treatment or they babied it along or whatever right when it happened, or it fixed, but it's not fixed. Like it's a flare. It's a common part of who they are now. And that I think just even speaking into the ortho side of that, of like some of these are really hard to treat if we're not appreciating the pelvic floor alongside like the adductors or the groin, or some of those areas, the hip, the SI joint, those types of things, just because it's so common, like they're so overlapping. I guess I don't really, I mean, I'm not going to come against necessarily like physical therapy in general, but just I think some of those injuries are so hard to rehab if we're taking a really focal, local approach to it. And then if we aren't appreciating the pain science behind it, if we aren't appreciating the pelvic floor specifically alongside these really orthopedic, athletic or sports injuries, then I am starting to see more adult men who have been kind of babying an injury along for 10, 15, 20 years now, that it fuels. It's not causing necessarily maybe their pelvic floor dysfunction, but it's definitely fueled by. And it's a piece that then we're working on it then at the same time. And so anyway, just something else to consider if you have just a lingering like pelvic injury. I've just had an increased number of people lately that have come in with or without pelvic floor symptoms, but they're like, I'm kind of tired of this. Like, I know you're pelvic floor, but can you work on this like groin injury that I've had for 10, 15 years or whatever, just because like they aren't getting better.
Yeah.
And then sometimes, unfortunately, we see that carry over into then tipping the scales to have pelvic floor symptom, like dysfunction symptoms, if we let that go on too long or never get it addressed and we keep pushing the same rhythms of life. But anyway, that's just something maybe a little soapbox that I've seen lately that I'm on, of just like, oh man, can we just do better at treating some of these like closer to the pelvis injuries right away and not just live with them, because then we're seeing them later with pelvic floor dysfunction anyway. And so, yeah, that's a good segue. I just
Yeah.
realized that. Okay. So, yeah, why do these issues get missed? We kind of have already hinted on like just the cultural stigma of men are often just kind of told to like tough it up, or they aren't as used to just being honest and forthright about things that are a little more personal or intimate in that part of our body. And it's not anything they do wrong. It's just the conversations are more open. And I think even in women, we have a long way to go, but the conversations are becoming more and more common on the female side to just talk about things. And the male side is behind. And so hopefully someday that won't be as much of a cultural stigma, but there's obviously there's a lot of layers to that, but I mean, men don't want to complain or whatnot. And so that can be a big barrier, and just the embarrassment piece there. But also, I think the lack of education. Most have never heard of pelvic floor PT. A lot of the men that come to me, thank goodness they have a provider that knows to send them. But a lot of people go to urology first, which that's not a bad first step by any means at all. But especially some of the pelvic pain type things, especially for the young guys, if there's anything innately wrong, then that can be confusing of what to do or where to go after that if there's not like an anatomical problem. And so just that education of saying what are some other options. Just I think there's primary and then there's usually urology. That's kind of just the natural progression of what we know of treatment options. And so that's a big thing. So I'm grateful for the providers that know to send them. Also, sometimes then you'll have like a wife or a mom or someone, that's like starts asking questions about their spouse or whoever. And then that can help open the door too for just that education piece. But that's a big barrier that we see. And then another reason that this can get missed is just the over medicalized path. And so, like Megan had talked about earlier, many of these guys are seeing 3, 4, 5 providers before they find pelvic PT. And that's really unfortunate. But they've maybe gone to their primary, they've maybe gone to urology, maybe gone to like a second opinion urology. Maybe they've talked to like a chiropractor, just different places, different paths that way. If it's more like constipation rectal, then they've seen GI too. Usually they've gone from urology to GI and back and forth maybe a couple times, just because it's like they're maybe constipated or they have rectal spasms, but then it's maybe causing, painful ejaculation or something. Or, the GI wants the prostate and all that check. So a lot of times they have bounced a little bit and not felt like maybe someone's just really taking the reins on their care or really knows what's going on. That can be then really frustrating, and that can kind of get in their head too if they're like going to different places yet not getting solid answers on that. And so anyway, what really the difference that we're seeing is that we have this medical route, which is really valuable. That's really helpful. Not coming against that, but that's going to be like pharmaceutical where you get a prescription and you try that, or an injection, or a nerve block, or surgery, or, a procedure of some sort. And those things are really, really helpful. We need those things. But at the same time, sometimes we're missing just the more conservative options that are in front of us. Hint, hint, pelvic floor rehab. But just where we're looking at the whole body and we're looking to say, I usually tell guys, because sometimes they come in really frustrated. So they're kind of like skeptical and like, are you actually going to help me? Or what should I expect here? Or like, how are exercises going to help? Right. They just don't understand the process. And we'll get into that here in just a minute. But I usually say, like, what do you have to lose here? Let's do some visits. And at the end of the day, if pelvic floor therapy doesn't fix your problem, then your body's better off because we can identify dysfunction. We can identify contributing factors. That first visit, we're looking for root causes, really. And so even if they don't think that's a root cause, we know better. We know kind of what's going on. Or sometimes it's not. Sometimes there is like multiple things happening at once. Maybe they do need to have something, from the doctor and alongside this. But really, there's a difference there. And we're doing a lot more functional. We're doing long term. I tell people, we're setting your body up for success. So even if you go and have that procedure done, you're going to have better outcomes because your core is working better, your pelvic floor is working better, your body mechanics are on, you have good blood flow, good circulation, so you can heal better in that area. And so really, there's not a lot to lose to just say, let's get your body as good as it can. We hope that takes care of it. But if not, if there's still something lingering, then the body is set up and those procedures or those injections or whatever it is, that's the next step with the provider in that way. We just see good outcomes then because we've taken away all the fuel of the dysfunction as much as we can. And then that allows that intervention to be as successful as possible.
Yes, absolutely. So, okay, let's talk a little bit about what pelvic floor PT or OT looks like in men. So, really, in a nutshell, those first couple of visits are really taking a really pretty in-depth medical history, symptom review, lifestyle, really digging into kind of your story. It's important that we get that. And so I know at Roxy, both of our clinics, we spend a lot of time with that because we don't want to have any stone not unturned. We want to know a lot of information that could be leading to this, even to the point of things that happened, 10 or 15 years prior. And so then we also go through kind of our assessment tools. So we're going to be looking at, of course, posture and core and mobility and breathing. Like I mentioned before, there could be an internal muscle exam whenever the patient is feeling like that, they're comfortable with that. So it's always optional, but external muscle exam, being able to assess the abdominal wall, the hips, all the things. So, it really truly is, we're looking at the whole body. And then from there, that's where we make we first start to put our little lists in our brain as providers of like, okay, what are we going to address first? And so the common treatment components are similar to what we would be doing if we were working with females. Manual therapy, myofascial work, trigger point release work, breath work, pelvic floor coordination training and relaxation. Maybe we're working on, like bladder retraining, sexual function rehab, that sort of thing, that we're doing that piece of it. The treatment is based off of what we find in that assessment. So it's not a one size fits all. We're not following a protocol. We're not doing the same thing for everybody. We also, we focus on trauma-informed care, privacy, and comfort, especially with this population, because it is like everybody should go back and listen to the episode we did with Bill Taylor. I can't remember what episode that was, but it's very good. We talk about this of just that level of comfort for men and that sort of thing. So the biggest thing we always say is to our patients is you are in control of the process. Our role is to guide, educate, and support, but patient is the one in control of the process. So that's kind of, a short little synopsis of what it looks like. And like I said, it's very, very similar.
I would say, just to continue on that, is a lot of men get kind of spooked. Either they're a provider or someone has tipped them off that we can do internal work.
Yeah.
or they're
Yeah.
blindsided. Like it's one or the other. And so they either come in
Yeah.
freaked out or they are
Yes.
come in being like, what are some exercises going to do? Wait, what? Like they're like, excuse me. And so a
Yeah.
lot of times, that can be a big barrier is that little nugget, that little internal nugget. And so I would say majority of my males, I don't treat them internally the first visit or sometimes even the second visit. We can usually see a lot of things and work on a lot of other components that doesn't require us to do internal work. Some men I never work internally on because that just freaks them out. And that's okay. Like, again, if that's going to fuel the symptoms because they're so nervous or they're so mortified, or it distracts them away from what's important, then we definitely don't do that. So if you're listening and you you have someone in mind, or you're a male yourself, or it's your husband, you're thinking there is no way that my husband's going to take me up on this, then that's just something like to know. I think
Yeah.
that can be a big barrier to be like, are you kidding me? I'm not doing that. I will never do that. I will say though, there are some guys that come in and they're so miserable that they say, do whatever it takes at this point. Like, I'm done with
Yep.
this. I want this to be behind me. This has been humiliating and embarrassing and annoying. So do you do whatever it takes? And so if you're not in
Yeah.
that camp, that's okay. Well, that's great because those guys are just so desperate for something that they don't care. Hopefully though, like I want to speak into that because that's probably the biggest barrier and the biggest fear that I see with men coming in is that our internal piece. And that's just one tool in our tool belt that we can use. And a lot of times what happens is we get rolling and the guys are like, okay, I do feel better. I do feel some change, but I'm still having that. And then they're ready for it because they see, okay, this can be helpful. This can work. And so then, I mean, it just takes a little bit of buy-in and that's okay too. Like, I mean, just what we just really, like Megan said, the patient is in control. That's with all of our patients, but I think that men need to hear that too, is that they're still in control, even though this problem they're coming in with feels really out of control. Our goal is to really get them to be in control of their symptoms, to have tools in their tool belt, and that includes within the treatment room as well.
Yes, absolutely. All right. Well, so basically, to kind of like for our wrap up here, like why men's pelvic health matters is basically pelvic floor dysfunction isn't just a part of getting older. So we know that for women too. So we need to be saying the same thing for guys because it is legitimately something that is being missed. It really truly is. You don't have to wake up and go pee every hour during the night. That doesn't necessarily mean just that there's a prostate thing. Like, come on, we are missing things here that we do not need to put in the basket of you're getting older. So I'll get off that soapbox right away there. Seeking care earlier equals better outcomes. The sooner we address it, the quicker it will get better. If this sounds like something, what we would encourage you to do is you can always book a discovery call with either one of our clinics to ask more questions or for a local pelvic floor therapist where you're at. Reach out to us if you need help finding one. If you've listened to this, you're like, yep, I know someone, share this episode or share the information. And then also, next time you go back to your provider, if this sounds like you're like, yep, this is what I need to do, talk to your doctor about it. Ask them. Most of the time, if you advocate for yourself, they're going to be in support. They may say, I don't think that's going to help. And it is still your right to say, okay, but I want to try. I mean, we have people in our treatment rooms all the time say, do you think that acupuncture will help me? Well, maybe it will, maybe it won't. Who am I to be the gatekeeper to say, oh, that's not going to help you? Because what if it does? So I always just say, like, ask. And even if they plant that seed of it might not help, do it anyway. I mean, because we have seen some really amazing things happen in our treatment rooms. So, all that to be said, in honor of Men's Health Month, men deserve information too. They deserve to be informed, receive compassionate care. Healing starts with awareness. And so if something feels off to you, this is for anybody and everybody that is a human walking on the planet. If something feels off to you, you don't have to live with it and you can find help. All right. Well, send us a message through our Instagram if you have any questions. Like and follow us. We appreciate that. And until our next episode, we will keep the conversation going. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.